Illinois Stories is brought to you by the Corporation for Public Broadcasting and by the support of viewers like you. Thank you.
Hello, welcome to Illinois Stories. I'm Mark McDonald in Jacksonville at Passavant Area Hospital, where they're observing an anniversary. 137 years ago this month, the first patient was admitted to this hospital. They've undergone incredible change in the last 10 years. But first, that anniversary. Dr. Walter Meyer, we note this week as you and I stand here in the Passavant Hospital, this is an anniversary week.
This is an anniversary week. It was in 1875, November the 24th, when the very first patient was admitted to Passavant Hospital. His name was John Johnson. He was a Swede, had a severely contused foot. I don't know how long he was there, but his records are here at the hospital.
The first patient 137 years ago this week.
That's correct.
Wow, and they've come a long way here, haven't they?
They have come a very, very long ways.
You started as a physician practicing here in 1957. So when you started, it was in the new facility.
It was in the new building, yes.
But you have taken on the sort of the task of becoming the unofficial historian, haven't you?
Well, I wrote a history of the hospital from the time before it actually began in the early 1800s, when it was just a 5-acre plot of ground with a double wide log cabin on it.
You know, I mentioned the old hospital. They moved here in 1953, but you're familiar with the old hospital because you were a patient there.
I was a patient there for 2 months in 1941, went in on a cold, snowy April the 4th, came out on a warm, beautiful June the 1st,
oh my goodness,
1941.
Months. And what had happened to you?
I had a ruptured appendix with peritonitis, and all my life probably to the nurses that provided good care there.
Yeah, but they couldn't give you antibiotics at the time.
There were no antibiotics available at the time. Penicillin just
You had to wait it out. You had to just sort of hope
Wait.
that, oh my goodness, I bet that was painful, wasn't it?
It was, but I think I enjoyed the trip. I think that's probably why I became a doctor.
I'll bet it is.
Yes.
I'll bet it is. So it was a worthwhile sacrifice, wasn't it?
It was.
You know, we talk a little bit about the history of this 137 years. We got to talk about some of the players who made this happen.
Okay.
And there was a young woman in Jacksonville who actually was responsible for getting this started.
Eliza Ayers was the one that started this. Eliza came here in the year 1830, traveling here from Philadelphia with her husband and 2 children, leaving Philadelphia in a carriage, coming down the Mississippi River, and coming down the Ohio and up the Mississippi and up here to Jacksonville. And she acquired the former Berean College buildings and the home of Colonel John J. Hardin for $12,000 at a sheriff's auction sale, and subsequently turned it into a hospital in 1875.
But it's not named the Ayers Hospital, it's named Passavant.
It's named Passavant now. At that time, it was called Jacksonville Hospital.
Oh, it was?
Yes.
Okay. Well, let's see where Mr. Passavant is in all this here. This fellow here, what was his role?
This is Reverend Dr. Passavant, and he came here very reluctantly because he had been to the Mutter House in Germany and met a doctor by the name of Dr. Fliedner, who had trained sisters or deaconesses to be caregivers at the hospitals. And he came to Jacksonville after Mrs. Ayers had pleaded a number of times and developed the hospital with her and brought it to Sister Carolyn Oche here, and she was one of the first deaconesses to serve this hospital.
Okay. Now, we also had a situation here, and this is interesting. Prior to all this, the first medical school in the state of Illinois was in Jacksonville.
The first medical school was here at Jacksonville at Illinois College. Started around 1841. And one of the doctors that came here was a doctor by the name of Dr. David Prince, who came from New York to teach anatomy and medicine at the medical school.
Do we have his picture on the wall?
Dr. Prince's picture is also here.
Is this Dr. Prince? Oh yeah, there he is.
This is Dr. Prince.
And he was, I guess, one of the most notable physicians at the time.
Well, he was very prominent. He didn't come right at the onset Dr. Harrison King was probably the primary physician at that time. And when Dr. Prince came in 1875 or shortly thereafter, he had come back because he had left here. He came here first in the early 1800s to teach the medical school, then went to St. Louis to work there at a medical school, the forerunner of Washington University, then came back here and opened his own practice, had a sanitarium on South Sandy, was probably a little bit ahead of his time, was an excellent surgeon, and it is said that he had patients coming from the surrounding states because he was such an outstanding physician.
And he must have liked it in Jacksonville
He
to have
apparently
returned.
did.
Yeah. Now, here's another thing. We saw this fellow earlier. Let's identify him this time. You can't have a new hospital without somebody giving you the land to put it on.
No, this is Mr. Charles Rowe, and in 1928, he gave this land on which this hospital is situated to be used in the future as a hospital. He also gave $200,000 to the hospital when it had some financial problems in the early 30s during the Depression that kept the hospital going.
And there's a sign memorializing him for his efforts and his gifts out there in front of the hospital.
That's correct.
You happen to know the story about when they moved from the old hospital in I think it was 53, to the new hospital.
Yes.
And of course, you had hundreds of patients, and not all of them could be moved easily. So it's interesting how they arranged that.
They did a wonderful job. I think they sent many of the patients home, and they didn't have ambulances available at the time, so they used the hearses that were used by the funeral homes to bring the patients out here. And they did a wonderful job.
They certainly did. Well, thank you for this visit and this historical perspective. We appreciate it.
Well, you're most welcome.
Dr. Chet Bone, when I asked to talk to somebody who'd been around the hospital for a while, they didn't hesitate. They said Dr. Bone would be the person, because if you don't mind me saying your age, you're 97 years old.
That's right.
Soon to be 98.
Yes.
And you were working here when the Passavant Hospital was located in the old building on State Street.
Yes.
And so you saw the transformation to the new building, and in fact, you're still working, aren't you?
I am, yes. I work for the state of Illinois as a medical consultant, yes, in the Bureau of Disability Determination Services.
Well, that's fantastic, and I guess they just want you to stay as long as you can.
Yes, I suggested that I quit working last December 31st, but they talked me out of it, and I'm still there.
And you received quite an honor in 2008, didn't you?
Yes, I was designated the Outstanding Older Worker of the Year for the state of Illinois.
Wow.
And given a trip to Washington, D.C., which was enjoyed by my wife and me.
Back in the 40s, you started working at the old Passavant Hospital before it moved.
1947.
1947.
Yes.
So that's more than that's 60. Well, I can't even subtract that much, but it's 60 some years ago.
Yes, it is.
And so you've seen such changes in the profession.
Absolutely.
When you look at what you used to do, what you as a doctor used to do and be able to do in the 40s, and what doctors can do now, is it just astounds you?
Oh, it does. And we, in those years, had much more concern for the patient's comfort, perhaps in seeing the patient at home just as well as in our office. When I first came to Jacksonville, I was told that the standard rate for office practice visits was $2 and house calls were $4. And it was quite a little while before we were brave enough to move those to $2.50 and $5. But to care for a patient in the hospital was $2 a day then also. So you see there have been some changes in the economics of medicine since 1947.
Yeah. Okay, so you come to the old Passavant Hospital in 47. Your service as a doctor is interrupted because then you go serve in the Korean War.
Yes, sir.
And then you come back and you get to witness the move from the old hospital to the new Passavant Hospital. What was that like?
Well, that was a step forward for the hospital and for the community, because we were moving from a facility that had been giving good service for many years, but we were moving into a facility where the laboratory service was improved and expanded, X-ray was expanded, and radiation diagnostic work. The emergency room, when you came in, was a much larger room then than we had at the old Passavant, but it was minuscule compared to the facilities that exist now. The operating rooms, the obstetrics area, everything was new, and the community looked upon it as a step forward.
As a doctor, did you find yourself wondering, gee, I don't know if I even know how to operate some of this equipment, or if I know how to find my way around this new stuff?
No, it was pretty much the equipment that we had before, some upgrading equipment, but the improvement in equipment has been a progressive situation over the years, and one is educated in its use as it appears. So that's through continuing medical education programs and so forth. I just looked upon it as a great experience. The obstetrics program was improved with the new hospital. The only thing that was a little bit of a problem, those of us who were delivering babies at both hospitals, then our saviors as well as Passavant, found the distance in between a little farther, and we had to hope that the mothers would time their deliveries appropriately.
You know, you being now 97 years old and having been practicing medicine all these years, do you see a great difference in the state of health of the American population than you did back in the 40s, for instance?
We've become more obese, and with obesity has come diabetics. Increase in diabetics has probably come an increase in hypertension, and the cardiovascular system in its entirety has suffered as far as the individual is concerned. We now are concerned more with exercise. We have rehabilitation service available after having an event such as a coronary artery bypass graft or any other cardiovascular event. We now have available here at the hospital a rehabilitation exercise that keeps the person in better shape. Didn't have that before.
Right. Do you have a personal secret to good health?
Laugh a little every day. Don't take yourself too seriously, and be concerned about the care of others. That keeps your mind going and wanting to be alert. And I think those are the ingredients of good health. I think the proper diet is appropriate. I eat a pretty general diet as far as that's concerned, but I probably am a little more cautious in the amount that I eat, and that is something I would advise others to do.
Thank you, Dr. Bone.
Been a pleasure.
Wendy Easton, we were just talking to a couple of doctors who have worked at Passavant for decades, and they were talking about what it was like in the old hospital when they had one room in the ER.
Right.
And now you have been in the emergency department for more than 30 years.
Right.
And now you come and move into this new facility. What is this like?
It was undescribable. We now have chairs to sit at. We now have computers to use. We function at a much more controlled environment. Patients get much better care. We have much better throughput for our patients.
And it's so big.
It's huge.
I mean, we're looking at half of it.
We went from 7,000 square feet to over 23,000 square feet.
It's incredible. Let's walk over this way, because that's only half of it. You've got, on a given time when you would be really busy, you can handle just that many more patients on this side.
Right. We have, there's 22 beds here. Every room is is a single room. Each room has a bathroom. There's monitors in over half the rooms. It's amazing the care we can deliver now.
You also have a critical care unit right here.
Right, 2 beds. It has everything you need there. It even has digital imaging for each bed.
And you were talking to me, and you're kind of bragging a little bit about the longevity of staff here.
Right.
People don't leave here.
No, they do not. I did the pediatric certification for our facility a few years back. The RNs, their longevity was 18 years just to this department, and the physicians were 11.
Wow. That makes your job pretty easy, doesn't it?
Yeah, except that we keep getting more and more census, so we have to keep expanding our staff.
Yeah, yeah. Well, it's nice to be needed.
Right, and we are needed for the community.
Yeah, thank you.
So, thank you.
Dr. John Roth, we had a wonderful experience early in this program talking to 2 elderly doctors who had practiced here some 60 years ago. And it's wonderful now because we get a chance to talk to a young man.
Oh, I like that young
somebody
part.
Yeah, there you go. Somebody who moved to Jacksonville to work at Passavant and is raising a family in this area. And why did you choose Passavant?
Well, my father's home area was a small community right down the road. And so my wife and I were looking at trying to get close to my parents. And so that worked out pretty well. We saw an opening here at Passavant where I can be employed directly by a hospital. And for a surgeon, that's really nice because the hospital worries about the paperwork and I just get to operate, and so that's really nice. So we could be near mom and dad, so it was a win-win situation.
You don't have to do that taking care of your own business, running your own business kind of deal. You've got the hospital to do that, and you operate.
Exactly.
Give me an example of the last half-dozen operations you've performed.
Oh gosh, I do a huge
do
range of
everything,
things.
huh?
Yeah, an appendectomy this morning, a gallbladder surgery in the evening, a few endoscopies before that. I did a colon resection yesterday. So it runs the full gamut. And that's one of the nice things about being in a small hospital like this in a rural area. I have a huge range of procedures I get to do. I'm a true general surgeon, which is very nice. That's what I went to school for.
Would you accompany me into one of the rooms here? This is the ambulatory surgery room, I guess. Is that what it's called?
Yes, this is one of our endoscopy suites. And so in this area, we've got some of the hardware here for doing colonoscopies, upper endoscopies. We can do interventional procedures here of a huge variety. And we usually do things with a nurse anesthetist or an anesthesiologist that provides sedation for the patients. So it's a very comfortable experience for them. It's an in and out, get your procedure done. They're monitored the whole time, and we have very high patient satisfaction in that.
And this is different than what people call the OR, the operating room, where we would have to be in scrubs if we were in there.
On the other side of the hallway, we've got 8 operating rooms, which is nice because when they built this hospital and did some remodeling, they overbuilt the operating rooms. And so we've got a few more operating rooms than you'd expect for a hospital this size. Now, I like that, being a surgeon, because I can get a space to work.
And you never have to say, well, listen, that doesn't fit into my schedule, or we don't have a room available. I mean, if you're available, bang, it happens. I guess.
Yeah, sometimes.
Now, this entire wing is only about 5 years old, and we're looking at a pretty up-to-date facility here.
Yes, and I've been here about 4.5 years, I guess. And so one of the things I noticed when I was being recruited here, they toured me around this wonderful brand spanking new facility, and I said, wow, this is great.
Yeah.
And I'm helping fill their schedule.
You went to University of Illinois for med school, is that right?
No, I was actually at University of Alabama at Birmingham for med school.
Oh, you went to U of I undergrad and then went down there for med school. I'm wrong again, aren't I?
Right.
But you did go to U of I at some point.
Well, actually, I was conceived there. My parents started out at the U of I, and that's where they met. And so when I was very young, I was there at the U of I.
All right. Well, welcome home. Thanks for the visit.
You bet. I hope Chet shows you the rest of the hospital.
We will. Dr. Lutz, during this program, we talked about some of the history and also some of the new things at Passavant. And what I wanted to talk to you about was, this aging demographic, the baby boomers. It seems like everybody needs a new hip. But the fact is, there are some things on the horizon that allow you and other surgeons to do work on the hip without doing replacements. How does that work?
Well, you're right. There are quite a few patients who are now younger having hip problems. due to other things such as sports injuries, arthritis early on because of weight, etc. And those patients are not ready for hip replacement yet. They're too young, too active. And we have new things on the horizon that we're doing for those people called hip arthroscopy, where we're actually making small 1 centimeter or ½ inch incisions. And we're going in with a hip arthroscope, which is about the size of a pencil. And we're cleaning up some of the spurs in the hip, cartilage tears. We're repairing the cartilage tears, cleaning up what we call the impingement process that causes some of this arthritis to progress over time, which then leads to hip replacement. That is helping a lot of patients with very small incisions. That's an outpatient surgical procedure.
And in fact, you're somewhat impressed with how progressive you can be here at this hospital. You can provide lots of things that almost anybody else can.
Absolutely. This hospital has state-of-the-art equipment not only in the emergency room but also in the operating room. They've been very cooperative with purchasing whatever we need as far as arthroscopy equipment. State-of-the-art procedures can be performed here as far as arthroscopy, knee replacement, revision, reconstruction work of the joints. And this hospital has been sort of a gem ever since I've been here.
Thank you.
Thank you.
Chet, Wynn, I feel like I'm in a submarine. It kind of sounds like a submarine, too.
Well, you know, it kind of feels like a submarine, doesn't it? Except I've never been in a submarine.
No, but so you don't know what that feels like.
Right.
But you've been in this hyperbaric chamber before, haven't
I've been in this hyperbaric chamber during orientation and then during some, when we showed it off to the community. Interestingly enough, when we have a TV at the end and the movie The Hunt for Red October was on, which I thought was pretty appropriate for.
For those who don't know, that was I think they got stranded in a submarine.
Submarine. Yeah, they did. They got. We don't have any problems with torpedoes or any bombshells around
This
here.
is a rather recent facility.
Yes.
How
4 or 5 years old.
4 or 5 years, and this promotes healing. How does it do that?
Well, what happens is that we come in here and basically we lower the air pressure so that it seems like you're at about 45 feet below sea level, and then we pump oxygen into you, kind of on one of these hoods. And you put this on your head. I'm not going to demonstrate, but they put this on your head, and then it pumps 100% oxygen into you, and it makes it goes through your blood, and it absorbs the oxygen better at that level.
And you heal many times faster than you would at a normal rate.
We do this for a wound clinic. We have a lot of folks that have wounds that can't heal, and with this service they heal much faster.
You've been with this hospital for a long time.
Almost 30 years.
So you've seen a lot of changes.
A few.
And every 4 or 5 years, it seems you all are adding a new facility. We've been to the new OR.
Right.
We're in the new hyperbaric chamber.
Correct.
The ED was new. How do you keep that momentum going?
Well, this is a community that expects its healthcare to be up to date. We've got a good volunteer community board that sees that they do that. The community supports us well, and we've had very good luck in the past recruiting physicians. So we kind of like to say we're a small town hospital. We're a hospital that just happens to be in a small town. We're not really a small town hospital. We're one of the larger rural hospitals in the country. So we're probably the smallest hospital that has attained magnet status, which is a nursing designation. So we're pretty. How
many patients in a year would you say you serve?
We serve through the actual inpatients a little over 3,000, and through our emergency room, we serve around 30,000 a year. So.
You know what I find particularly interesting with somebody in your position? There are so many changes, not only that have occurred in the last 10 years, which you've kept up with, but there's so many changes coming, and we don't know what the changes are going to be. How do you prepare?
Well, I think you just make sure that you've got a solidly run hospital, and you kind of prepare for everything. We are very proud of the fact that we're an independent hospital and have been able to stand on our own for 137 years. It's becoming harder and harder to do that as we're looking at the Affordable Care Act and how we're going to have to interact with other hospitals and other providers. So I think we've got a good solid base, good community base, and a good facility. So we're ready for whatever comes, and if we have to make some changes, we'll make some changes.
Thank you.
Mm-hmm.
You'll notice there is still some construction going on here at Passavant Area Hospital. This new building is being built by Memorial Medical Center for its doctors and the doctors of Springfield Clinic. With another Illinois story in Jacksonville, I'm Mark McDonald. Thanks for watching.
Illinois Stories is brought to you by the Corporation for Public Broadcasting and by the support of viewers like you. Thank you. For a DVD copy of the program you've just seen, send $19.95 to Network Knowledge, P.O. Box 6248, Springfield, Illinois 62708. Be sure to include the program name, subject, and when the program aired. You can also order with your credit card by calling 800-232-3605.